You tell me when we're live, Logan Stewart. Don't you lie to me, Logan Stewart.
Thinking about it. We're live.
We're live. Okay, Z-Pack. Apparently we're live. This is your boy, Z-Dog MD. Okay, a little bit of housekeeping because there's a podcast and a video cast, okay? Today we have a great guest, Nina Shapiro, MD. I'm going to talk about her in a second, but first, if you guys have just crawled out from under a rock, you will be delighted to hear that we are now offering continuing medical education credits for doctors, nurse practitioners, PAs, and all nurses, and anyone who takes ANCC or ACCME accredited credits for select shows. And I will tell you which those shows are. This is not one of them, but in order to get the code to be on that show, for that show to actually get credit, you need to be a supporter on Facebook, and we'll put a link in how to do that. It's $4.99 a month, or go on Patreon, and at anything above $5 a month, will get you the access code to the individual shows on Physician Weekly's website to get that CME. Why would you want to do that? Because CME sucks, and you know it. It's boring. Can I get a what, Nina? Tell me.
What?
Yeah, that's right. And that's a professor of head and neck surgery at UCLA, okay? It's fun. We make it fun. We make it engaging. We talked about measles. That one's going to, we're going to give you the code for that really soon. So that all out of the way, our next guest is astounding to me because she's a medical communicator, a author. She appears on a ton of TV, CNN and NBC and PRN and WBC and all the other networks that don't exist that I just made up, but she's amazing while being, again, a professor of head and neck surgery at UCLA, director of pediatric ENT at UCLA Medical Center. So she's an academic, she teaches, she does research, she takes care of patients, and she's just written a book that's come out in the last year that is called, and Logan can show the book right here, Hype. It is a doctor's guide to medical myths, exaggerated claims, and bad advice, and how to tell what's real and what's not. Now, I read this book, and I was like, this is basically what we try to do on our show every day. It's the gold standard of cutting through BS from a doctor's perspective. We talk about different things on the show about elephant and rider. This will grow your rider. It'll grow your rational sense so that you can talk rationally with our patients, or if you're a patient, you can learn what's real and what's not online. And so, Dr. Nina Shapiro, welcome to the show.
Thank you. So great to be here.
We're doing this thing where we wear headphones now so we can kind of look cool like on Rogan's show. And I was like, well, now, Dr. Shapiro, if you don't like the headphones the way they look, then you don't have to wear them. And I put them on and I'm like, somehow you've rocked the headphone. It's like
so styling.
Right?
I wear these at home.
See, it's like accessorizing. And you're in LA where appearance...
I'm starting a trend, right?
Appearance matters in LA.
That's right.
How did you trained on the East Coast, right?
I did. And then I came to California for a year a long time ago. And it's one of those things that you get there and you stay. It's really hard to leave.
Yo, West Coast is the best coast. You know what I'm saying? I don't even know what I'm saying. It's funny though, because you're one of those, are you one of those people who are like, yeah, I went to a school in Boston?
Yes.
So you don't say like, I went to Harvard? Or
never. Never.
See, Harvard?
No, we don't say Boston. We say in the Northeast.
Oh my gosh. So my wife is a Harvard
nice.
undergrad and class of 94. And she's always like, yeah, I went to school in Boston. I'm like, you know what? Call a spade, you intellectual elite. Just say Harvard, okay?
Right.
I'm always like, I went to Cal Berkeley. I have to like express it.
Right.
Like, and yeah, I smoked some weed because it was Cal Berkeley. I may have done acid. What? And so you have to just spell it out. But you guys can just say the Northeast and get away with it.
The Northeast, very sweet Boston, not Cambridge. Yeah.
But UCLA really kind of captivated.
UCLA, I say.
Yeah,
we don't have a problem with that.
Because that's kind of cool. It's not too pretentious.
Yeah.
Right.
Yeah.
Now, as a Cal alumni,
sorry,
you guys like to try to, take that whole title of best public school in California, but I don't know.
Well, we had more applications last year, I think.
Oh, here we go.
I know. For the undergrad, at least.
There you go.
Yeah.
Well, I was a UCSF kid. So
okay.
I went from Cal to UCSF to Stanford, so I did that kind of counterclockwise.
Okay. And you said all of them. That's good.
Yeah,
well, I went to Cornell. We all say Cornell.
Oh, Cornell.
Yeah.
So were you born in New York?
I'm a New Yorker.
I'm a New Jersey guy.
Oh my God.
Yeah. Can you tell?
Did not. I'm a Long Island girl.
There
you go.
I sensed a kinship there. And that brings me to this, because Long Island is like, you don't believe the hype. You're like, listen,
Yeah, no nonsense.
here's the deal,
Yeah.
right? And you're highly educated, really, really smart, accomplished surgeon, great communicator, and you wrote this book, Hype. But why this book? What was the need that you saw?
So a lot of people ask me that on this book tour. They say, okay, so let me get this straight. You're a pediatric ear, nose, and throat doctor, and we're supposed to listen to your advice about general health. You don't know anything. You know about one little area of tiny little humans, right?
But Nina, kids are just little adults.
They're just tiny little humans, right?
Right.
Yeah, you just like half the dose and it'll all be good. But I just, I work with families and I have friends and I have kids who have friends and their parents, and I hear all this nonsense all the time. And over the last decade or so, I would hear these things and people would say the meaning that they knew what they were saying, and I would stop myself and say, wait a second, did I miss that day in medical school? Did I miss that day in medical school?
You missed the essential oils day?
No, exactly. But they say it with such conviction that I would start looking these things up and learning about it. And these were smart people. I mean, a lot of this is like, oh, you're just an idiot. What do you know? But these are smart, educated, caring people with complete, utter nonsense that they would be telling me and asking me. So I figured I needed to write this.
And see, this is a point that we cannot belabor. These are smart, educated people.
Yeah.
You're in LA, so you get a lot of that sort of set, right? You get the Hollywood set, you get the LA set.
Yeah. Academics.
Academics, and there's a bit of a Dunning-Kruger effect, right? Meaning you know a little about something, but you don't have enough metacognition to know what you don't know.
Right.
So if someone online, if you're Googling online and you see that, you know what, I should get gluten-free water.
There you go.
Because it's the glutens, which are a toxin,
that's right,
in water that are going to hurt me and my children.
How did you know?
Right.
Yeah.
And so you think you know a lot about something, whereas as doctors, like, okay, listen, you're taking care of people like airways and kids. I'm terrified of that.
Yeah, me too.
Are you?
No,
but seriously, I think a little healthy.
You always, you never get used to it. Your heart rate never slows down when you hear an airway emergency, or when you're in an airway emergency. It's not like, oh, just another obstructed kid, no big deal. It's always the same. Yeah.
You know, I get scared. I'm just sitting here listening
to
it.
Me too.
As an adult hospitalist, the RRT, the rapid response team is called, and you're thinking,
and when
okay,
it's a baby,
see, this is terrifying to me. That's why I
Yeah.
couldn't do pediatrics. I have too much. I can't have compassion for them. I have empathy, so I feel the pain of the baby. I feel the pain of the parents, and it's debilitating. Whereas with adults, I'm able to compartmentalize and have cognitive empathy. So I'm able to understand the pain, understand they're going through it, cognitively appreciate it, but detach in a way that I can deliver compassion, which is love in the face of suffering.
Nice.
As opposed to being debilitated by this feeling of this poor little baby is suffering, this airway, he's got Haemophilus influenza epiglottitis.
Oh, here's hoping they don't. Yeah.
Because they are vaccinated.
Yes,
hopefully, right?
Yes.
And so, you know what you don't know. You know enough to be afraid, enough to keep your adrenaline going, and to be thinking all the time. But the Dunning-Kruger set online, and I think this is where you said it, it's educated people. So this book is interesting because I was trying to figure out when I first started reading it, I was like, who is this book for? That was the challenge. Is it for doctors to try to give them, and nurses and healthcare professionals to give them ammunition to say, oh, when a patient asks you about this, here's a good way to explain it, because it certainly works for that. Or is it for patients to look at and go, I've been reading all this stuff online. I wonder whether I'm supposed to drink 8 glasses of water a day.
Right. Yeah.
Is that really true?
Yeah.
And there's a chapter where you even talk about that.
Right. Yeah.
What's the deal?
I think it's for both. I think it is, as far as the doctors, it does give some tools for people in healthcare to communicate better with their patients and to understand where their patients are coming from. Because we live in a tunnel oftentimes when we're in healthcare, and we think that, how could you not know this? Because I know it and I work it every day. But it gives you some exposure to what people not in healthcare are thinking about, what they're worried about, what they're concerned about, and what they're going to be asking you. But I think it's, it's really for primarily the non-healthcare person to understand what they're looking for. So if they are fearful of vaccines, for instance, which is a big concern that a lot of people have, this explains why they shouldn't be afraid of them and why they're actually good for you. If they think that they should not eat gluten, this will tell them why it's probably okay to do that. So it's a little bit for both. I think also for a lot of people in healthcare, you know your area. I know about airways and I know about pediatric ENT and about ENT in general, but did I know that much about nutrition before I worked on this book? Not necessarily. Or about water, or about even vaccines are not necessarily what I do day to day. And most people in healthcare have a really narrow area. So this gives them sort of a broader area to learn about.
In the sense as a doctor reading, and I got that sense, I'm like, shit, I should kind of know this, but I don't.
Likewise.
Like, are you really supposed to drink 8 glasses of water? Or what's the deal with organic? Is that good or bad?
Right,
GMOs, are they good? By the way, here's a comment. I won't read the name because it's a HIPAA violation, because it says, Dr. Shapiro, you rock. Thanks for taking such good care of our girl.
Aw, my pleasure.
Is it a HIPAA violation if I read the name?
I don't know.
I'm going to read it because she put her name here, Alexandra Silver.
Oh, lovely.
Yeah.
Thank
and
you.
Yeah, and
Hi.
Megan Kraljevich says, too much Dunning-Kruger going around these days. I mean, it's kind of true. Yeah. So why are they called essential oils, says Kimberly Larson. Oxygen is essential. Defecating is essential. How is lavender oil essential? They are the essence of the lavender bush, I presume.
There you go.
So how did you... And I heard you on Sam Harris, by the way, who's a personal idol of mine. He's a friend of yours.
Likewise, yes.
You did a great job explaining to lay people what it's like to be us and how to cut through hype. But in this book, when I was reading it, I was like, how the hell did you research this? Because it's got a full footnotes at the end, and I'm like, this is hard.
Yeah, it took a long time.
Yeah.
And so I will say, and to all my lovely, I think this is like anesthesia awareness, lovely, happy anesthesia week.
Oh.
But I did a lot of the work during turnover time. So I do a lot of surgeries, and I do a lot of short surgeries.
Yeah.
And sometimes my surgeries are shorter than the turnover time, which means when, for people who are not in operating rooms, it means the time where the operating room is turned over for the next patient. And that could be anywhere from 15 minutes to an hour.
Yeah.
So, times 8 in a day, it gives me a lot of time. So I did a lot of it during my work day, and it took a long time. It was really, a year or two of getting all this information.
So did you
together.
go out to the nurse's station and work on it? Did you go run to an office? How did you do it? Oh, I won't say anything.
No. We have computers in our operating rooms.
Got it.
Yeah. And I just Googled everything.
Yeah.
And there was all the information, right?
Of course you did, Nina.
Right,
Yeah. Actually, it's fascinating. So there's a chapter on, you talk about Dr. Google, and you talk about how do you cut through, because when you Google the top 3 results, they may be biased with commercial interest.
Yeah.
And we can talk about some of that. But it's interesting because I did a show about Googling my daughter's rash.
Oh, yeah.
Yeah. And I was like, okay, so what happens when a doctor
right.
use Google Dr. Google?
Yeah.
And I'm like, we do it all the time. It's a dirty secret.
Sure.
We do it in a way that hopefully our patients don't entirely get put off by it. So what I'll do is, you know what, I'll be right back. I step out, there's my Google. But my Google search is very different than a patient's Google search. It may start with the same term, but the rabbit hole you go down is very different.
Right.
And it's guided. And so I ended up diagnosing terraforma firme dermatosis with my kid, which is effectively a bunch of crud on your skin that you wipe off with alcohol.
Ew.
The way you turn it, the way you diagnose it, you wipe it with rubbing alcohol if it goes away. I mean, which any old wife could have told you in an old wives' tale. But for me, I was like, I figured it out. I was going to take her to the dermatologist to save that copay.
Yeah.
But what happens when a patient Googles?
Right. So when a patient Googles, first of all, I think that it depends how you Google. So if you just Google rash as opposed to worst rash of your life.
Right.
So I think patients will oftentimes put in some qualitative words associated with that. So they'll say, if they have a headache, they'll say, terrible headache or worst headache or something like that. So that will give you different answers than just headache, for example. And then I think that we as doctors will tend to go to the, PubMed sites, the .gov sites, the .edu sites, as opposed to the .com sites right away when it's a health problem.
Right.
And then we know those little green ad boxes are advertisements, and so they are selling something, and they probably paid to get there.
Yeah. And speaking of which, remind me to talk about the Best Doctors magazines, where you can certainly pay to have yourself bumped up.
Yeah.
Sure, it's peer voted, but
we're
Nina,
all
I'll
peers.
tell you what, I'm going to take you golfing. Can you vote for me as best internist? Because I refer to you all the time.
Right.
So it means very little to a patient when they're trying to choose a doctor.
Yeah.
But so back to the Google search. There are ads all over. This is what happens. The most common thing I get in Facebook messages, one of the most common things from my fans, and a lot of them are healthcare people, but maybe Maybe it's a dietitian, maybe it's a respiratory therapist, maybe it's a CNA. And they'll say, what do you think of this? I just read this. Tell me what I can think about this. And you look, I immediately first look, it has a little thing with a little video, and it's got an inflammatory art, you know, like mercury's killing babies, whatever it is. The first thing I do is look at the source. If it's Health Nut News or if it's Natural News, are one of these things that are known anti-vax quackery. They're selling you supplements. They're doing this other stuff. I can immediately go, just look at the source. Start with that. And the answer is yes, it's nonsense. But a lot of patients don't have that capacity because who's going to teach them to do this?
Sometimes it's in the newspaper. Then what do you do?
Then what do you do?
Yeah.
If I read it in the Fresno Bee, it's law. As far as I'm concerned. At least that's what my dad says. My dad, who is a physician, sends me clippings from the Fresno Bee.
Yeah.
But so in the book, you talk about, well, how do you negotiate a Google search? And one of your tips was .gov.org.
Right, .gov.org. And then also, it's very boring looking, but Google Scholar is a public site.
Yeah.
And it's an offshoot of Google, but it's an academic site. There are no pictures. There are no shiny ads. It's just articles.
Yeah.
But you know, I think that everyone should learn to read an abstract and read an article and learn the basic terms. You should learn this in middle school.
Yeah. You know what? Well, let's do a show on it. That'd be great. Like how to digest an article, just even the abstract.
It's really important because I think even journalists don't know how to do the health journalists need to understand when they're reporting on a new study in a reputable journal and they say, oh, this now X now cures Y or X now causes Y. Well, wait a second, you didn't really read the article well, and you didn't really understand the information that the writers of the article were saying, even if it's a scholarly piece. So I think that people don't give themselves enough credit and they just say, oh, I don't understand that. That's science. And I just want to get the bare bones.
They can absolutely do it. Yeah. We're going to start giving people the tools to do this, I think. And this book does that. Because this book is great because you don't have to read the whole thing in a sitting. You can go find a chapter that you're interested in. Yeah. And go through it. And actually, so Paul Kennedy has an interesting comment. Thank you for verifying that those Best MD or Best Docs magazines are a scam. I hate those frauds. Now, that's a little harsh, but I'll tell you, I throw it away when it arrives because it doesn't mean anything. And I look at it here in Vegas. It's got this Best Doctors thing. And I'm like, the guy's a criminal. That guy does unnecessary caths. That guy, I mean, I know all these people.
Yeah.
So to me, it's very tough, even as a doctor. And you were talking on Harris's podcast too about how do doctors find good doctors.
Right.
We're all about 2 degree separation from somebody that's really good. Right. And we listen to the nurses.
Oh,
so
yeah.
if the nurse is like, that guy is a 007, like License to Kill.
Right. Yeah.
Then, and so it's kind of interesting. Now the Google thing, the other thing that you had brought up in the book that actually reminded me, and I forget this, is there's a lot of pay to play journals.
Yes.
Describe that to me.
So there's some journals that are free to everybody. And most journals you can get the abstract, but there are what are called predatory journals. And that's the real rabbit hole danger area where it's not either it's a scam and they just are asking people to pay to have their stuff published in it. And it's just purely a moneymaker with no science involved. And it's really hard to tell because they have really esoteric names and the science sounds legitimate, but it's a complete scam. And then there are even scams on the scams. So scam journals will buy other scam journals, scoop them up, and double their money. It's brilliant. It's a brilliant business model, and it's just exploding now. So it's real, and I get these lovely invitations. You can be the editor of this journal that doesn't really exist. A lot of them don't even exist, and just so they can get some names on it, and then you'll pay to get your articles in it. So the journal levels have grown to such an extreme, but there's so many that are just complete fake journals now.
So fake news, basically.
Fake news.
Fake peer review.
Fake journals making fake news.
So how do we cut through that? Because anti-vaxxers will send stuff from these journals.
Sure.
And, patients will send it to me and I'll say, this journal sounds bogus to me. I mean, I've never heard of this journal.
Yeah.
Or if you read the article, if you actually read it, you go, this is nonsense. There's like 3 patients in the study.
Right.
And it's biased from the beginning, but it takes time to go through all that.
It does. And again, they'll make it sound really sciencey, and they'll use some medical terms and big words and scary words, like death or or horrible
I'm not scared to death, Nina Shapiro.
I can take it.
I'm ready to go any minute.
So,
like Biggie Smalls, ready to die. You didn't take care of Biggie Smalls when he was shot in L.A., did you?
I can't tell you that.
Okay. Oh, that's right.
HIPAA.
Of course you can't tell me that.
Right?
You know, and as a pediatric ear, nose, and throat doc,
never
I'm
know.
pretty sure.
You never know.
Yeah, RRT, Nina Shapiro to the emergency room. There's a rapper shot in 6. That's not
acting like a child.
Acting like
right?
a child. Right? Yeah, exactly. Relating to the journal piece, we talked about the other how to navigate Google. There's so much hype. What's interesting in the book is you talk about kind of navigating a lot of it for specific topics. It's impossible to give a framework for every topic. In other words, here's how you approach any
everything.
topic.
Right.
That's
right.
really hard.
Yeah.
Because you have to alter the approach, in my mind. Have you thought about that? Is there anything you can think of that's a commonality in approaching hype?
Well, I think, and this is just, a trite term, if anything sounds too good or too bad to be true, it probably is.
Yeah.
Whether it comes to nutrition or exercise or a diet or a detox, which is ridiculous. Sorry.
No, please.
It's ridiculous.
Please, you're preaching to la choir.
The detox choir.
Yes.
So if any of those things are to any extreme, whether it's in the grocery store when you're shopping and you see that there's this miracle food that's going to make you live to 1,000 or some miracle pill, it doesn't exist.
Yeah.
And I think you can apply that to anything, and even to illness. People get terrified when they get a horrible diagnosis. You have this horrible diagnosis and that is a death sentence. Well, maybe not. Everybody's going to die, sorry to say, as far as we know.
You speak for yourself, Nina Shapiro. I've been eating kale.
I could tell.
I
was going to say.
Look at the skin turgor. Look at these dark circles under my eyes. You tell me who's been eating their recommended daily allowance of kale.
That's right.
Gosh, man, it's really, really tough because then you have people like Dr. Oz who are out there. And you don't have to badmouth Dr. Oz. That's my job. But, he miracle bean cures whatever.
Right.
And that's the thing. It's like you said, if it sounds too good to be true, it probably is.
Or too bad to be true.
Or too bad. Like this will kill you. This will give you cancer. This will.
Yeah.
Even cigarettes kind of give you cancer for
They
sure.
do. Yeah.
Okay, forget it. That's a bad.
They are bad.
Crack cocaine, not always bad. Sometimes you need a.
We used to use cocaine in the operating room all the time.
Now, you're an ear, nose, and throat
Yes,
doc.
we used to have bottles of it in our emergency room.
I want to ask you this question. What do you mean used to? Do they still use it? I thought they did. No?
I don't think so. I think it's just gotten too hard to manage.
I see.
That we cut down.
Schedule 2, though.
Yeah,
Not Schedule 1. It has a medical use.
Right. I think it's still on the formulary, but they don't have it routinely
It's hard to get. Yeah. Well, imagine the cocaine drug rep showing up. He's
They're
like,
really happy.
Dr. Shapiro, I got 3 papers here. They're all from predatory journals.
Exactly. Doesn't matter.
Escobar, Pablo et al. They've written extensively on cocaine. Have you seen the movie version of Miami Vice?
That's right.
Because it really spells it out. That's a funny skit. We should think about that, Tom.
Cocaine lunch instead of a drug lunch.
The cocaine drug lunch.
Yeah.
Listen, new Coca be gone. Hey, what is the brand name for cocaine?
Yeah.
God, I want to get into Hippocrates and look that
That's
up now.
That's a good one. Yeah.
So anyways, so Dr. Oz, but now I'm gonna get a little controversial here for a second, Nina Shapiro, because I like you and I want the world to know that you're awesome. You've been on the doctors, not once, not twice, many times, and normally I'd make fun of you for that, except I've been on the doctors twice, and I'll tell you,
the doctors.
You know what? I'm gonna come clean. People are gonna hate me for this. They were great guys and gals. Sonia Batra was my intern back in the day.
Yeah.
Dr. Ormond is just a sweet, awesome, smart clinician.
He's an ENT doctor by training. Did you know that?
I thought he was plastics.
He's an ENT doctor, and then he did plastics after.
I did not know that.
Yeah.
And Travis is a bro. So all together, and the thing is I want to get your take. Why do you do that show?
I enjoy it, actually. And I think that I've been on the show since day one, since their first season, literally their first month, when they were falling all over each other. They didn't really know how to read a teleprompter. And it was hilarious. And, it was doctors on television. It was this novel idea. And they ran with it and it worked. And I think that, the basic idea of the show is really to educate. And when, if the ratings were falling, then they have to entertain a little bit more. So it has become more of an entertainment show. But I think the core of it is still to give good information. At least whenever I go on there, I just give the information that's correct And whether it's sensationalized by the show, that's Hollywood.
That is Hollywood. That's why I think, so it's interesting, and this is worth discussing. I saw an episode you did where you were talking about nasal balloons for ear infections?
For clearing eustachian tubes to prevent ear infections.
In children.
Yeah.
And you had this beautiful mom and daughter there sitting on the fake doctor's bed.
What do you mean fake?
Oh, sorry, it was
it's
a
all real.
Oh, yeah, they have money. It's Dr. Phil money. That's big money. It's big money. Shh. And so, by the way, I love their set too. It's right there in Paramount Studios.
Oh, it's so
much
fun.
fun.
It's a lot of fun. The fake sky on
fake
the outside,
sky on the
little
outside.
carts.
You feel like a movie star when you show up. And you did this thing where you talked about it in I was like, holy crap, I've never seen a doctor on TV be so rational and measured. Because you said, the study showed maybe there's a 10% improvement. So it's a lot of work, but there's a 10% improvement. So you have to decide. Yeah. So then you had the kid do it, and she does. She's so cute. The tears are starting to well, and everyone's clapping and they're supporting her. And I saw they pan the camera to like Travis. They pan back to you, and you didn't really know you were being filmed, and you just turn to the little girl and you give her a little wink, like, good job, kid, like, you hang in there. It was such a sweet moment, and it showed who you are as a clinician. You care about
Thank you.
patients.
I do. I mean, I love my patients, and I take care of kids, so it's fun, and I do, and I feel for them. And I think, as you said earlier, that one of the reasons you didn't want to take care of kids is because it's too close. Well, I have empathy in a different way. Like, I know what it feels like to be scared, and I know what it feels like, I don't want to take my medicine, or I'm afraid at the doctor's, or I don't want to get a shot. So I feel like I can sort of go into their head a little bit. Like, here she is, this little 8-year-old in front of a studio audience and on television, and she's just stick this thing up her nose, and it's mortifying. And so I feel for her. I wouldn't want to do it either. I wouldn't want to do it as an adult. I don't think I did it. I think they had the other co-hosts do it, right?
Orden do it.
And I think Jennifer Ashton was on at the time, and they were all doing it, but they don't care. But I wasn't going to do that.
So Orden takes the balloon, and he was like, puts it in his nose, and he goes, check it out. And just, it's like this big. It was crazy. I'm like, that guy's vital lung capacity is tremendous, and his nares.
See, and he's an ENT doctor.
Right.
He knows.
He keeps that
knows
snot
how to do it.
clean.
Yeah.
So
nasal hygiene.
I'm going to give you the official ZDogg MD absolution for being on the doctors and encourage you to do more. They asked me to do more, but the thing was, what I noticed is, and this is something I want to talk about with you, there's teaching the teachers, and there's, teaching the students. Our platform, when I started ZDogg Industries back in 2010, that's me and on YouTube. Ago. I know, right? Yeah. Old. I've started noticing gray hairs in places, and I was like,
you have a beard now, so you don't have to hide it.
I don't even hide it, but I'm like, there's other parts of my body. I'm like, that's not supposed to be gray. And so, 2010. My goal was I'm going to educate patients so that because I was as a hospitalist, I would see all the same thing, the hype, the failure of like vaccination. I would see misunderstandings and people, especially in Palo Alto area, man, it's the same.
Oh my goodness,
gosh,
bad,
everybody's got the Dunning-Kruger thing going because they're all pretty smart. Yeah. And so they overestimate how smart they are in fields they don't know anything about. So I realized really quickly that what was resonating was my own frustration with our own system and how doctors were burning out and stuff. So to be able to connect with them became my priority. And if you can influence 1 or 2 healthcare professionals, they're going to influence thousands of people. So the reason I stopped doing the doctors is, and they're wonderful people, is that it wasn't reaching my target audience.
Right.
So I figure I'm going to focus on this instead of flying to LA and doing that. And honestly, like you said, it's more entertainment. So you have to kind of get it to a common denominator where people understand.
I mean, I think the last few times I've been on, it's definitely glitzier than it used to be.
Right.
But it's also just getting the information out. I remember one of the first times I was on the show, it was to demonstrate a new instrument to take out tonsils. And they actually had me use the instrument on the set on a piece of chicken. It's disgusting, actually.
Wow. Raw chicken.
Raw chicken.
So you're like getting ready to get salmonella.
Totally disgusting. But, that was much more medical as opposed to now where it's like, wow, here's a big picture of a tonsil. So, they've changed the format a little bit. But again, I think it's just keeping it accurate.
That's the main thing.
And and just speaking to whoever is the audience.
Right. Tom Simon wrote us in. He says Coca-Cola sends coca leaves extract to Mallinckrodt to produce cocaine. So medical cocaine.
Oh, okay.
Yeah, if that's true, that's really interesting. And actually, Michelle Klein says, I had a pharmacy school professor tell us how his hospital pharmacy was robbed decades ago for its cocaine, almost none of it because they kept so little. They kept so little for use, so there's just very little bit. But yeah, it's fascinating. So, relating, what did I want to ask you now? Oh, ENT. So because you're a pediatric ENT, I think a lot of our tribe is going to want to know, okay, first of all, what would you tell like a referring pediatrician? Now you have a big audience right now. They're all they're all medical people. Okay, you have a chance to tell them, please, when you refer X, do Y, or please don't do X. These are your colleagues in pediatrics. What would you tell them?
So I think one of the things surgeons have a little pet peeve about is when we get rule out.
Oh, yeah.
Okay, rule out neck mass. Okay, like you have eyes. Is there a neck mass or is there not? It's this mystery. And my husband, who's a surgeon, it drives him bananas because he's a cancer surgeon. And, rule out neck mass. I'm not going to see a rule out neck mass. There's either a neck mass or there's not. So I think, sorry, neck mass is fine to say. But if it's either there or it's not, that's one thing.
Yeah. Well, the radiologists hate that too. Rule out cancer. It's
right.
like, that's not what the scan does. No. That's what you do. Yeah.
Right.
Okay. So that's one pet peeve.
That's one pet peeve.
Hit me with more. This is good.
Oh, man. Like history of multiple ear infections. Oh, my goodness. Johnny, how many ear infections has Johnny had? He's had 2 ear infections. Wow. Thanks for playing. So,
but how many ear infections is a problem?
Not 2.
Yeah, but
so,
it's
like
7.
3 to, well, I mean, even if it's like 3 to 6 in a 6-month period, but like a 4-year-old who's had 2 ear infections their entire life, and they just want to get it checked out. Well, no, there's got to be something a little, where's the punchline? What am I missing there? So that's something.
Now, why is that bad for you? You get paid to see patients. Is that a bad thing?
It's, I try to, I'm busy, we're all busy. And so, we only can see so many patients in a day and so many patients in a week. And so you want to really maximize your time and their time and not waste other people's time by seeing something that you need to see. Right.
No, I hear you. I'm going to make an analogy. So as a hospitalist, it's usually like, a primary care person admitting, rule out pneumonia or something.
Right.
And you're like, well, that's not really a diagnosis. We need to.
Right.
But here's
it's pneumonia or it's not pneumonia.
And it's a pneumonia that requires hospitalization.
Right. Yeah.
And that's where it's always like, well, do you really need this patient to be in there? Because this hospital is a dangerous place, right?
I mean, that's where you get pneumonia.
That's where you get pneumonia.
Right.
That's where you get enterococcal pneumonia. Right, exactly. It gets really ugly. But in my current full-time position, it's people who send me, and I consider this a referral, a parody idea.
Oh.
Yeah, and it's always an OPP parody. You down with OPP? Oh, you should make it EKG, or you should make it PUD, or you should make it. I'm like, I'm pretty sure you figured that I get 1,000 of these. And the second problem, and this is what I'm going to tell people, is like, don't send me a parody idea unless it has some message or heart behind it. Right. If it's just a funny
like a one-liner,
that's not a song. It costs a lot of money, takes a ton of our time to do a parody. Now, it's fun. You can send it to me, but I'm going to ignore you. Yeah. And with a smile.
Now I got to think.
Right.
Wow.
Now you got to come up with a good parody.
I know.
Any other stuff you tell pediatricians?
Sore throat.
Sore throat. What's the deal with that?
So we like to think of it, is it a surgical problem? Oh, no. Right. Oh, no. Well, then why are you here? Sorry. No, I mean, there's some non-surgical sore throats we do need to see. We need to see horse kids, right? Yeah. They can have problems. We need to see, tonsillitis, because that could be, no tonsils, tonsillitis. You take your tonsils out, you won't have tonsillitis anymore.
Right.
Pretty much. But some of the sort of wishy-washy stuff that is not necessarily surgical or tertiary care level stuff.
At UCLA, yeah.
Yeah, we try to dissuade them.
Suck it up,
We'll see them, but But
it's good. But it's good because this will, there'll be a couple pediatricians who'll hear this and be like, okay, all right, well, and the thing is, you understand in the primary care space, it's hard because
it is. They're busy.
They're busy, and sometimes it's patient expectation.
Right. Sure.
Well, how come I don't get to see a specialist? Well, you don't need to.
Yeah.
We would say that a lot at Turntable, our clinic is like, wait, can I see the cardiologist if you want an unnecessary cath? Because if you're a hammer, they're probably going to nail you.
Right.
Yeah.
Right. Yeah.
But it depends. And so here's a question though. So what would you tell paramedics and EMS people? Ooh. Okay? Because I was realizing, wow, you deal with a lot of airways in kids.
Yes.
You're the final common pathway for all airway disasters, meaning if it's bad. What would you tell paramedics and EMS and these firefighters in the field about kids' airways and managing them?
That's a great question. So I think from what I understand, paramedics cannot intubate kids.
Yeah, I don't know the
that
answer
right?
to that. People, they'll weigh in right now.
Maybe. I remember asking, certainly at our local fire station, what's the smallest endotracheal tube for intubation, and it was like a small adult, like a number 6, which is really like a small adult size, not for a kid. So I think for airway stuff, what we always like to think is that's one thing where, for so much of medicine, I'm like, you're fine. But when there's an airway in a kid, I say always err on the side of caution. And if the parents or the caregivers were worried enough to call you guys, they need to come in.
Yeah.
Because I think sometimes they'll get there, the kid will have some acute event, and if the paramedics get there and the kid is fine, sometimes they won't take them to the hospital. And let's say they aspirated a peanut and then it goes into their lung, they'll be breathing fine, but they still have a peanut there. So, or if they had some bleeding after a tonsillectomy, the bleeding stopped, they still need to come in.
Yeah.
So I think that's one thing for paramedics is that if it's a kid, even if they seem fine when you get there, schlep them to the hospital. Let them deal with it and let them be mad and, waste the ER space. But I still think, there's so many things that are missed with kids that it's better to just, when it's an airway, just get them in there.
And with kids, you're talking about a quality of life of years and years and years that's sacrificed if you screw up.
Yeah.
Whereas if you fudge a little on the 92-year-old, you know what? Let Betty stay home.
She's tired.
She's tired. She's looking a little punky. Maybe don't bring her in and give her C. diff. Let's, but with little kids, the difference.
Yeah.
What are the most difficult things you deal with as an ENT? Like, how do you give bad news to parents and kids that you're telling, they have a cancer diagnosis? Yeah,
that's, thankfully we don't have a lot of that. But when we do, we have to deal with it, and we always have to spin it positive. And sometimes, depending on the child and the kid's age, the parents don't want the kid to know right away, or they want they want to tell them in time. So, sometimes we'll use words like, oh, you have an issue, a medical problem, you're going to need some more treatment and some more testing. So not necessarily, kids pretty young know the word cancer. So we may use a different term, a growth or something like that, that's going to need some treatment. And, I think we always have to spin it positive for parents, even, realistically, but, we're going to do everything we can. I never say everything's going to be okay. Yeah. Never say that,
right,
even for anything. But, I'll always say, oh, we're going to do our best and we're going to, give all of our effort to take care of this problem.
This is real interesting to me because in adults, I'm very torn about how to do this, because if you spin too positive, what the patient hears is so distorted because they hook onto the positive and then you're pummeling a, 90-year-old woman with lung cancer chemo at the end of her life, and she should just be comfortable. Now with kids, I can understand that might be different. You do have
It is different. And sometimes obviously, in ICUs and, neonatal intensive care units or in pediatric intensive care units, there often comes a time where it's enough.
Yeah.
And, withdrawing interventions is something that, is a big decision that families need to make.
Are you directly involved in those end-of-life decisions?
I am partly involved. It really depends. For a lot of the really, really sick kids, sometimes their airway problem or their ENT problem is a small piece of a very bigger puzzle. Yeah. So, if they have severe, brain damage or, brain death or something like that, where it's a very large multidisciplinary decision, we may play a small part. But, yeah.
How tight are you with the respiratory therapists?
Very.
Tell me about
that. They save us.
We have tons of respiratory therapists. And here's the thing, Nina. Okay, I'm going to rant for a second. These people, and yes, I said these people, okay, they must be so unsung and so underappreciated. Yeah. They are the most common people who email me, why haven't you done anything about us? Even though I have. It doesn't matter. Yeah. Because they're so used to being ignored.
Yes.
So tell me about them.
So they are like the quiet... I'm going to say angel because that sounds kind of religious, but they're like the...
You can use it. We've already cut through the hype.
They come in, you bring in a kid up to the ICU or even like a kid that's in the OR or in the recovery room. And then all of a sudden, you just hear on the phone, like, call respiratory. I'm like, oh, and then they come and it's just like everything just kind of magically gets better.
Yeah.
And, whether it's, fixing the ventilator or giving them, some sort of treatment or just figuring it out, it's like they're magicians. And I don't want to, that makes it sound a little bit hokey and, hocus pocus, but they're incredible. I mean, and again, they're always very quiet. It's not like, I'm the respiratory therapist, I'm here. You almost never know that they're here, but you just know that things get better when they're there.
That was a beautiful summary of what they do. I did the keynote for the AARC, their big thing, and they were lovely, wonderful, motivated people. And I know it's the same thing as a hospitalist. You call RT and you're like, thank God.
Right.
Someone who knows
Whatever
what they're doing is
do.
here. Yeah,
Yeah.
exactly.
Yeah.
Whatever it is, because I don't know. Yeah. And there's some other people who can do little tweaks of it. But man, an RRT at the top of their license doing their game.
Amazing.
Dude, and they'll teach you how to work that vent. They'll teach you. I mean, it's transformative.
Yes. The other group that's very unsung and I gave a talk at their national thing, are the surgical techs.
Okay,
right?
Okay, listen,
you
they
go
are
like
the
this
second
and
most.
something appears in your
Yes,
hand.
Yeah, tell me about the techs and tell me why you throw stuff at them. Nina Shapiro.
Oh, because they deserve it. No. So one of my besties,
room turnover.
Yes, right.
Yeah.
One of my besties, Eric, hi Eric, who is now an RN, was initially a surgical tech, and we became friends because I hit him.
Oh,
yeah.
Wow! Tell me about
I wrapped
this.
him on the knuckles with a hemostat, which hurts.
Yeah.
Yeah. So we're doing a tonsil, and I have the instrument stand. It's called a Mayo stand right above where the patient is, and it's kind of like indirectly attached to the patient. So it's kind of attached. So if you lean on the Mayo stand, we were always taught like you're kind of leaning on the patient's jaw. Right. So please don't lean on the Mayo stand. Lean on the Mayo stand. Please don't lean on the Mayo. Then the third time, wrap. Stop it. Get your hand off. And we've been friends ever since. We love each other. So, but
silent no more, people. Silent no more. This is violence. This is violence.
Yes, but I keep hitting. No, I don't hit anymore. I get fired. But they are really unsung. And I remember a couple years ago, I was working with a tech, and I hadn't met him before. And I said, "Oh, are you, part of the OR nursing program?" And he said, "No, I'm just a tech." And I said, what? No such, and I wrote this whole piece about no such thing as just a tech. And then it went viral on, no such thing as just a tech. And the whole tech people were all like, oh, and even some like woman had a shirt that said, oh, I'm not just a tech. It was so cool.
That's awesome.
It was really fun. So they're very unsung because they are also usually in the background and just things happen.
Yep.
And it's because of them. And it's not just, it's not just a robot. They actually have to think things out. So,
and this is the thing I think the lay public doesn't understand.
No, what happens.
How amazingly complex and team-driven these things are. Yeah. And that was a great story. It's the medical lab techs are the other guys.
Right.
But we made a rap anthem for them.
Oh, nice.
We made a rap anthem for the RTs. We haven't gotten around to the surgical techs yet. And it's because
it's a good one.
It's because I absolutely don't understand their space. So to do these things, it's hard. You saw One Sikh just now, the video we just made. Yeah. I had to know how Indians think, how Indian physicians think, how to write those lyrics.
Yeah.
How could I write a scrub tech rap without knowing how they think? So I need like
you have to come to the OR.
I have to come to the OR.
You have to spend some time with them.
And spend like a month. Yeah, which is
You're welcome to.
Thank you.
It'd be fun.
It'd be awesome. I'll fly. It's only like a 40-minute flight.
Easy.
Yeah.
Easy. Yeah.
Oh man, you're gonna see me there all scrubbed in awkwardly. The gloves like number 7.5 gloves, all jacked up, and I'll be like,
no, you.
Yeah. I'll lean on the stand, and you'll be like, get you. You know what? Do you know this thing that in the Spanish lexicon, la chancla? Have you heard
I've
this?
heard. What
so
is
la
that?
chancla is a thing that Spanish mothers, Latina mothers do where they take their shoe off and throw it at the kid.
Oh, nice. Okay.
So it's called la chancla.
Yeah.
So,
okay, I'll do that.
So you should do that
I
next
have a
time.
clog.
You have a clog.
It'll hurt.
I understand. I read somewhere that you have fashion clogs, like very fancy clogs.
I do.
Yeah.
I do.
Tell me about this.
Yes, I love them. So now they're kind of boring. So they're just blue. So I put stickers on them. I have my I voted sticker on it. It's really cool. But yeah, I have pink ones and silver and ones with little snowflakes. And because the OR scrubs are such an ugly, nasty green, and it looks so boring, and especially for the kids.
You
I
make
like
it pop.
Dress it up a little bit.
In clinic, do you ever wear? Do you wear a white coat and all that?
Never.
So for kids, you never.
But I don't wear one of those like stethoscope. I don't wear a stethoscope. No. Yeah.
Nina Shapiro, where are your pieces of flair? I'd really like to see your pieces of flair because here at UCLA we're very big on pieces of flair.
That's right.
I'm not sure you're a team player, Nina Shapiro, because the CEO just walked by and he said, "You know what? Nina is missing a few pieces of flair."
I know, right? I wear my mask because I didn't get a flu shot. No, just kidding. Just kidding.
Oh, tell me about flu shots.
Flu shots,
what are
yes.
your thoughts
So,
on
at hospitals, and I think at most hospitals, you have to, if you want to work with patients, you have to get a flu shot. If not, you have to wear a mask from November 1st to April 1st.
Yep.
Yeah,
Yep. Oh,
that's stylish.
you know what? I just thought of a parody for this. Are you ready?
Ready.
It's a little Spice Girls.
Can I take some credit?
Yeah, you can take credit. It's like, if you want to be my doctor, you got to get with that shot. Got to get with that shit. You know, getting it is so easy, but autism, it won't give you not. Okay, forget it. Never mind. The whole thing's a disaster.
Yeah,
Nina
that's
Shapiro.
bad.
I've made an ass of myself in front of 400 people live right now.
Oh my goodness.
But, you know,
Sorry.
Donald Kunzer says oh no, he's talking to someone. Jennifer Piles says, it does take a village. I just wish people gave it their best instead of trying to get out of work. Healthcare would be better if people actually cared as much as they claim. I have more coworkers that run and hide when they're needed. It's a damn shame. What's up with that?
I don't know. I think that's bad morale. We have pretty good. Yeah.
Oh, so bad morale.
Yeah, I don't think that's good.
It's a chicken and egg thing, isn't
Yeah.
it? Because if you have bad morale, you're going to have bad people. People are going to shirk duties.
Yeah.
Like Logan's morale's terrible. He just walked out of the room.
We're on our own.
Exactly. Whereas chicken and egg. So what if people are terrible, so morale emerges as bad?
That's bad. I think that, people have to be in there. There has to be some incentive. Doesn't necessarily even have to be financial incentive, but there has to be incentive. And hopefully the incentive is to take care of people,
Heaven forbid.
patients, right? I know that's sort of a basic thing why you'd go into healthcare. And that's unfortunate. I think where I work, fortunately, the people are in there to do a good job and do good by each other and not dump on each other, as we would say, and take care of the people, take care of patients. So that's too bad.
Have you heard about this Dr. Death thing? This podcast. So
Tell me.
It's a really popular podcast, a documentary series about a doctor, a surgeon, a spine surgeon in Texas, who was basically mutilating patients, and the hospitals just kept shunting him to different hospitals.
Oh, wow, yeah.
Yeah, and he got away with it. He killed some people. He maimed a bunch of people.
This is a true story?
It's a true story.
Wow.
And he's, a psychopath. Something's wrong with
yeah.
him. And the question is, how do we, as caregivers and patients, self-police surgeons? And I'm going to focus on surgeons because we talk a lot about medical people.
Yeah.
Patrick Ha, who is the head of surgical head and neck and oncology at UCSF, is a friend and has been on the show a couple times talking about HPV-related cancers. Okay. Now, but we never really talked about the sort of surgical mentality. How do you guys self-police? We talked about maintenance of certification for internal medicine, but what about surgeons?
So we have CME too.
Right.
And the MOC is sort of a little bit gray as well. But we do have optional MOC for us.
I see.
But I think just on a day-to-day basis, that is very tricky. So for instance, if you think a surgeon is sleep deprived, I mean, that's just a basic thing. We're all a little bit sleep. No. We all
I'm right now.
Right. I'm all sleeping with the patients. But, if there's a real serious concern, ethically or medically, then, we do have channels to go through. It's tricky and it's easy to say like, oh, well, what would you do if you saw so-and-so and you think they were, drinking or something like that, or they seemed like they were taking drugs or anything inappropriate, would you report them? And everyone would say, of course I would, for the good of the patients and for the good of the hospital. But when it's your friend or your coworker, it's a lot harder. Tricky.
I've had difficulty with this myself. And that gets to another question. So what do you see as the most difficult challenge facing academic medicine today?
Academics is tough. I mean, and I've been in it for a while. And, I think some of it is that funding is more challenging. The government was, we were supposed to have a speaker come a couple weeks ago, but from a government institution, but they couldn't because the government was closed. Oh. So, a lot of the funding comes from the government. Right. So that's less and less. And I think the pressures, people, doctors become doctors to take care of people and to make things better. And when you have extra pressures to, see 50 patients in a day and crank out all these papers, something's going to give. And I think in academic centers, we're trying to make it, you can be more clinical and do less research or do just research. But I think it's a challenge to figure out the balance and how to do good medicine, take good care of patients, and also do good research. You can't do everything.
Yeah, I mean that was always the tension in academia.
Yeah,
It still is.
Yeah.
So I'm glad that's not different. Are the residents completely worthless now?
Totally useless. No.
Useless, right?
I love my residents. Yes,
I
they're
see
just getting
someone's
younger.
backtracking.
They're
Mhm.
just
They're
getting younger.
right?
They're
That happened.
adorable. Yeah.
I remember the first time I noticed they were 10 years younger than me.
10.
I started going chest pain, and that was 10 years ago.
Right. Yeah. So they're kids. They're great. I mean, they're hardworking. They're motivated, and what's nice is that they're not jaded.
Yeah, not
like
yet.
we are,
Not
know,
yet.
which is
Yeah.
good. And
Yeah.
we try to, and people, and I even talk about it in the book that, you don't work as hard as we used to work, and you sleep too much, and you have too much time off. But you know what? They're happier.
They're happier, yeah.
They're going to be good doctors. And yes, they'll spend fewer hours in the hospital, but I don't know if that's necessarily going to be a negative.
Can I ask you a question? So relating to that, been talking a lot on the show about a book called The Coddling of the American Mind by John Haidt, psychologist. And he talks about how we're raising a generation, Gen Z, the iGen, where they're fragile now. So we're helicopter parenting them. We're letting them be on social media very early. We've avoided free play and outdoor activities because of fear, unfounded by statistics. The world's getting safer. And now they're ending up in college where they're demanding safe spaces and trigger warnings, and where they and they appeal to authority for help instead of solving the problems. Do you think children are really what John Haidt proposes, which is anti-fragile? In other words, you stress them with intolerance and they get stronger. They grow.
Oh, yeah. Yeah.
I think I agree with you on
Yeah.
that. Yeah. I mean, there's a limit, right? Because you can have adverse childhood experiences where you're damaging children.
You could, but I think, and one of the other posts that I wrote, so the tech post was very positive. Then I wrote this post about how our children we're coddling our children.
You wrote a post about that?
Yes. Oh, and I got you should lose your license. You shouldn't even be a parent. You're the worst person in the world.
Tell me more about this.
Horrible. So I wrote a piece about how, why does every child who gets a dental procedure need anesthesia? Meaning like laughing gas or general anesthesia. You know what? It's a shot.
Yeah.
It's going to hurt for a second.
Yeah.
And then you're going to get your tooth pulled or cleaned or whatever.
Yeah.
And let's get over with it.
Yeah.
And, oh, no, they can't feel any pain. And, it's going to hurt them. Yeah, it's going to hurt. And, oh, my goodness, I was clobbered for that. And I think that, and with my kids, I don't want them to suffer, but I also want them to be able to tolerate some discomfort, right? So,
yeah.
And not to think of it as a punishment either.
No.
That's the other thing where people equate, a shot at the dentist, it's like a punishment, like a shot, you're gonna get a shot.
Right.
And I hate when parents say that in my office, because they say, if you don't behave, you're gonna get a shot.
Oh, now
I'm
it's
like, if you don't behave, you're not gonna get a shot.
Yeah.
You maybe not get a cookie or something afterwards, but I don't have any shots, so I don't even think about that. But this connection of punishing people, that you're hurting them, as opposed to, you know what, it's okay, it's going to hurt, and then it'll be better, and then that's the end of it, and you can take it because you're 5.
I think it's hilarious that you got a bunch of crap for that, because it sounds right. It sounds like people will give you crap. Now here, okay, I'm going to play devil's advocate for a second, but not really, because I agree with you 1,000%. I tell my kids, toughen up, buttercup, all the time.
Nice,
I'm like, you know what? The real world, and that's the thing with residents too. It's kind of like, we're protecting them a little bit, because the real world kind of sucks as far as the practice, because there are no work hour limits. There are no, and you're trying to hustle, and you're sleep deprived. So some training for that is good, but not too much, and not breaking them and not making them jaded.
Yeah.
Because I was so jaded coming out of residency at Stanford that I left medicine for a year, worked in tech. I was that jaded.
Yeah.
And it was that time away that made me feel that pull, that drawback, like the meaning in my life has been sucked away, and reconnecting with it, I was re-engaged for so many years. So, but we had Amy Baxter on the show. She's a pediatrician, and she specializes in kind of pain. And there's some data now that says, look, you can give little kids under 4 years old as many shots at once as you want. In other words, get them on the vax schedule, hit them with MMR and all the stuff at once. No problem. They don't remember it.
Right.
It doesn't condition them in any way. They're fine. But between 4 and 7, they're concrete thinkers.
Right.
They remember.
Yeah.
If they get more than 2 or 3 shots at once, the likelihood of them developing a more permanent needle fear, affecting their ability to, say, get HPV vaccination as a teen, goes up by like double.
Wow.
And it's interesting. It's early data. I'm not sure I entirely believe it, but it's interesting, because is there a window where, but here's the twist. I'm not saying don't give them shots.
Right.
All you have to do to eliminate that bump in the studies was give the injection one at a time over a couple days. So you don't have to delay the schedule. Just go, give it here, come back
Right.
tomorrow, give it here. It's something about that
Right.
changed the conditioning.
And I know a pediatrician who does that.
Got it.
He said, he says he stays on schedule, but he doesn't give them all at one visit.
Yeah.
And it also, so that way, and even though he knows this isn't really medically necessary, but he said that's way if there's a reaction, you can identify which injection it was. So if they
Right.
get a fever, it was from that particular injection.
See, to me,
Fine.
heaven forbid, Nina Shapiro, that we actually do something that's kind of common sense, but also science-based. I think there's a lot of dogma around vaccines that hurts us
Yes.
as clinicians.
Yes.
So, no, you must stick exactly to the schedule. Now,
Right.
you get a guy like Bob Sears, who's off his rocker,
Yes.
who's like, no, you spread them out because of the toxins. It's like,
Yeah,
no,
it's
that's not what it
nonsense.
is. That's
Yeah.
nonsense.
Yeah.
And let's say that again. That
Nonsense.
is nonsense.
Nonsense.
Nonsense. Let's say it in different accents. Nonsense?
Nonsense.
Nonsense. You see-
Nonsense. I'm from
See-
Long Island.
Yeah, nice.
Thank you.
Nice. New Jersey nonsense. So that's garbage. But the idea that, again, that could we be inducing needle fear and could we watch for specific reactions? Sure. And here's the thing. There are occasionally exceedingly rare serious reactions to vaccines.
Yes.
Now, what will happen is Del Bigtree will hear this podcast and he will edit out the part where I say he'll cut out occasionally or exceedingly rarely serious adverse reactions to vaccines. And
Clever.
he'll put it all over the web.
That's why he's in Hollywood.
That's right. Never listen to Hollywood about anything except for action.
Right.
I just saw Indiana Jones, the first one, Raiders of the Lost Ark.
Oh, nice.
Again for the first time in like 15 years.
Yeah.
And I was like, that holds up.
Yeah,
Like it's
still great.
really well.
It's still great.
You know who was amazing in that movie? This is a total digression. Karen Allen,
Oh,
his
I
love
remember
interest.
her. Yeah.
She was like a feminist icon.
Yeah.
She punches
She's tough.
Indiana Jones
Yeah.
in the face. She's doing shots, putting this Mongolian dude, Nepali dude. I would want to be culturally sensitive. He was Nepalese. Under the table, drinks him under the table, 3 times her size, and stands up and punches Indiana Jones. I mean, that is
Love it.
dope.
Love it.
And you know what? She had a beauty about her in the thing that was really compelling, and I had forgotten. It'd been so many years. Anyways, that has no medical relevance at all, except for indie
Girl power and girl power.
and girl power.
Right?
That's right. Indie, the ark. I'm concerned. Mankind was not meant to open it, Indie. And then he opens it, and Nazis get their faces melted off.
Yes.
Which
remember that.
as an Ashkenazi Jew,
Yes.
I think we can all get behind Nazis getting their faces
Yes.
melted off.
Go for it.
So where were we in our discussion? Let me see. There's things. The Apple Watch.
Oh yeah.
Tell
I
me.
don't have one.
I don't either.
Yeah.
Is it hype
Yeah.
or is it hope?
Well, I think
You see what I did there?
I like
Hey,
that.
that's going to be the sequel.
Hyper hope. Yes.
Hyper hope.
Or that could be like a soap opera or something.
Oh, I like that.
I think if you're using it for communication and for what is it, for email and your telephone and for a watch, it actually tells time, I think. Right? Then
Who needs
that's-
that? You have a phone.
That's true. I think it's fine. I think all of the wearable technology has a place, but I think it's becoming too big of a place too fast. And I think that eventually it will become much more high tech where you can get an ultrasound of your wrist and you can get an ultrasound of your heart and you can measure your blood pressure and your sugar if you're diabetic and all these sort of more detailed personalized technology. The basic step counters are, okay. Are they 100% accurate? No. But, it's okay. I think it's more entertaining. And if you look at it that way and not rely on it for your health at this point, I think it's fine.
And you have a chapter on this, actually.
I do,
Yeah.
because I think it's interesting that people get so hooked on, I'm going to get I guess Fitbit is one of the most common ones, and I'm going to lose weight. And the small studies show that was actually the opposite.
Yeah.
That people who got them to get in shape
Did the
did
opposite.
less than the people who just got in shape. And when my kids go away to camp and they go to camp on a beach, I wear one of their Fitbits just to see what it's like, and it makes me a little crazy.
Yeah.
Like, oh my God, I've only had 9,992 steps. I better run around the house.
My buddy would just walk back and
Yeah,
forth.
yeah.
I haven't reached my 10,000.
Yeah.
Which, by the way, you mentioned in the
Arbitrary.
book is
Yeah.
arbitrary.
Yeah.
It was a significant number in Japanese culture.
Yes.
And the Japanese had a particular device and they're like 10,000.
That's it.
And that was it.
That's it.
And they did it just like that. 10,000.
Yes.
And
it's actually more, so that your buddy needs to keep walking.
Right.
Yeah.
Right. It's something like 13 or 14 for kids.
Yeah.
Yeah. I see. I read your book.
I'm
Most people are like,
impressed.
Z-Dog
Yes,
doesn't read the
you knew
books.
some
No, I read all these
details.
books.
That's
I
pretty
read all
good,
these books
yeah.
because I learn from them, and they're great books. And
you.
this has given me like, now I'm like ready to fight people on the 8 glasses of water a day. Because listen to me carefully, Nina Shapiro. These 2 assholes behind you, Tom and Logan. Okay. They're constantly drinking bottled water. And like Logan's like, well, it says that you're supposed to eat 8 glasses of water. And I'm like, no, that's just horseshit. I can't tell you why because I haven't researched it.
Well, if you're eating like pork rinds from
well, right, like they are right now.
Right.
Tom came back from the convenience store with like 2 bags of pork rinds.
You need some water.
He's like,
with
I'm going to
that.
get us lunch, Logan. What do you want? Just get me something good. He comes back with 2 bags of pork rinds.
Gross.
And
I'm keto, Z.
he's keto. He's keto. He's Pickle Rick. He's Keto Rick. So this idea that you have to drink 8 glasses of water came from some like 1920s.
Yeah. Also arbitrary an idea, and it's not a bad idea, but it's not literal.
Right.
And most food has water, and most food is mostly water. So you get it. You don't have to drink 8 glasses of water per day. And coffee counts, which is my favorite thing.
Coffee does count.
Yes.
And people will say, oh, you don't coffee because of the diuretic effect.
Nah.
First of all, diuretic effect's not that big, and
It's not that bad.
You adjust to it.
Yeah.
And so drinking coffee does count. So I count it. And you eat a strawberry, something like 80% water.
Fruits, vegetables, or water.
Now, if you're eating pork rinds, you're right, because it's dense and doesn't have water in it.
But salty.
So you end up having to drink more.
Yeah.
And this idea that you can actually harm yourself with too much water is a real
And, as a hospitalist or an ER, you probably see these, the little old lady who sits home and drinks tea. Right?
They come in
hyponatremic.
They come in with like 113 sodium.
Yes, yeah.
And what's interesting is it's so chronic that they don't even bat an eyelid.
No, they're fine.
Betty is just a little bit off.
They just
Like, what year is it, Betty? 2017.
Close.
Okay, that's just a little bit
pretty
off,
good,
right?
yeah.
Whereas if you or me had an acute, if we had potomania, and this happens, we see this with MDMA intoxication, so ecstasy intoxication. So people go to a rave, and everyone at the rave is like, you should drink lots of water because the Molly will make you very hot. And you'll be dancing and you won't know. And so people are like, yeah, okay, so they're just drinking all this plain free water. Turns out MDMA in susceptible people causes an SIADH type syndrome, the syndrome of inappropriate ADH, where you don't process free water well. So you hold on to it and you don't pee it out. It's a water problem, not a salt problem. So what ends up happening is they have a seizure right there on the dance floor. People think it's breakdancing. They ignore the first seizure. And then the second. I mean, I'm making that part up, but I would ignore it. And then the second one, you're like, now that's the wackest dance moves I've seen because there's a little bit of spit and some vomit. And they're not breathing. So they end up in the ER with a sodium of like 110, and acutely in a young person that can be fatal.
That's really bad.
So then
even an ENT doctor knows that's bad.
See,
right? Yeah.
We were on the same wavelength of bad things.
Yes.
By the way, what's the worst thing that you deal with in ENT pediatrics?
So airway bleeding. Airway bleeding.
Yeah.
Yes.
Yeah,
yes.
bad.
Yes.
Not good.
Really bad. We have there's some important blood vessels near where we work.
Apparently.
Yeah, big ones.
How good were you at anatomy in med school?
So not too bad.
Yeah.
Yeah. So we did at Harvard Medical School.
You mean in Boston?
At
Northeast?
Harvard, we did the arm or the leg, and I'm not kidding.
The arm or the leg?
Yes.
So you didn't do both?
No.
Wow.
I know. They were kind of like,
choose.
It's all good.
I would have taken the leg because the leg is dope.
I did the leg. Did the leg.
There's more stuff in it.
It was longer. Yeah. It took a little time.
Longer.
So, but otherwise, I figured it out.
That's awesome.
Yeah.
So here's a dumb question that I don't know the answer to. And I'll tell you why.
I may not either.
I recently did a home sleep apnea test. Just to see, because my wife says I snore like a racehorse and I wake up a lot in the night. And I have weird dreams. None of that is, of course, necessarily correlated with sleep apnea. So I'm like, cool. I saw a guy to talk. I was like, we'll do a show on sleep apnea. Can I use the device? Sure. I did it. Turns out I don't have sleep apnea.
Oh, great.
Yeah.
Wow.
Which is great.
Okay.
I still snore like a dog, but whatever.
Yeah.
But do kids get sleep apnea?
Yes.
Tell me about this. I did not know that.
Yes, kids get sleep apnea, and it's not just okay if kids have sleep apnea and that they'll just grow out of it and it sounds cute and they're snoring. They can have sleep apnea just like adults, and they can have really bad, and they can drop their O2 sats to the 50s.
Wow.
Yeah, it's just a real deal. Most commonly in otherwise healthy kids, it's big tonsils, big adenoids. Take them out, they're cured. Sometimes there's some other issues going on if they have some jaw problems or some neurologic issues, but it's next to ear infections. The most common thing I see is pediatric sleep apnea.
So what happens? The tonsils and the adenoids act like a ball valve?
They just grow and they just take up space.
And they just
yeah. And then when they sleep, they're choking on their own stuff.
Well,
take them out.
That's how Hendrix went out. And you know what? Hendrix was
and
a hero.
Bonham, right? John Bonham.
John Bonham.
Yeah, dating myself.
Do you remember Spinal Tap? Did you ever see that movie?
Yeah.
He's like, he died by choking on his own vomit.
Yes.
The authorities didn't even investigate because you can't really dust for vomit. So sleep apnea in kids. So you treat maybe by taking the tonsils, depending on what the cause is. Do you have a lot of kids on CPAP?
So no,
because
they
that's
don't
not
tolerate it,
they don't
and they
tolerate.
won't. Even, and I do get families who ask, can we, and some of them, you'll take out their tonsils and adenoids, and they'll still have sleep apnea. So some of them do need it, but it's pretty intolerable. For
I can't
a kid.
imagine.
I have a couple patients who are on it. Pretty cool ones.
Oh, cool ones.
But you got to be pretty cool because it's this mask and it's forcing air in,
It's like
and it's annoying.
Darth Vader. Yeah,
or it's like that nasal balloon.
The nasal
It's annoying.
balloon.
Yeah.
You know what? They're not old enough to understand the reference, but to put it on them and strap it on and pretend they're Hannibal Lecter.
No, my kid had a face. What are those called? One of those face things for his bite.
Oh yeah, a
headgear.
Headgear.
Oh, he loved it.
Was he like,
going on? Yeah.
Do you hear them, Clarice? Do you hear
He was
the
like,
bleating
some
of the
fava
lambs?
beans, mommy. I want fava beans. It's like, dude.
Do you take
young
care
for this?
Do you take care of a lot of celebrities?
I can't tell you that.
Okay, but you can tell me
I
that you
do.
just take. Yeah,
I have. It's
Okay,
fun.
that's
It's
awesome.
actually kind of cute. It's fun.
But
Yeah.
Relating to that VIP syndrome.
So here's the thing. The best celebrity patients are the ones who don't treat themselves like VIPs.
Tell me why.
They just come and they're just patients. And then I walk in the office and I'm like, oh my God. Because oftentimes if it's the mom and they have a different last name, I won't even know until I walk into the exam room.
Wow.
And I'm like, you're you.
Wow.
And I just got to be really cool because I'm doctor. And those are the best because, I treat them like patients and they get treated like patients and they get great care and they get the same care.
Yeah.
When it's there's so-and-so coming in and they take the back door and and, alert and they get to be seen in this room as opposed to that room. It's the same care, but it's just a bigger production and everybody's on edge.
I'm with you 1,000%. When we had VIPs, it was always everyone's stressed. The routine is jacked.
Yes.
The routine is jacked. And this is the thing, we are creatures of routine, especially when we do high volume stuff, like what you're doing.
Yeah.
So if you move my cheese, if you take my surgical tech and swap it for, Jerome who throws feces,
right.
then things are going to be different. Or, oh no, I don't want residents on my care.
Yes, I get that. Yes.
Right?
Yeah.
I'm in a teaching hospital, but I don't want anyone, Sam Harris said this on your show. He's like, I don't want them learning their first procedure on me.
Yeah.
I'm like, Sam, your poop stinks just like mine. And I'll tell you that, the residents are often supervised, which is what you said.
Right.
But either way, I think the idea that then you take that away and now the doctor's nervous.
Yes.
The system doesn't work the way it should because we're patterned and we're in grooves and shit goes wrong.
Yeah.
I mean, I think so.
And it's also, even if and usually it doesn't, thankfully.
Yes.
But
we have to say that.
But we're just
for
so
the
much more
censors.
anxious. And then the rest of the day, you're like, oh,
Yeah.
it's done. Thank God.
Yeah.
Now I can start my day because I just did this other thing, which was actually the biggest, most stressful part of my day.
Right.
So, because they need to be first or early. And again, sometimes they need to be because, again, you don't want the paparazzi. We get the paparazzi that come and it gets, it's a big problem.
Like Logan and Tom, because they're film guys, they get offered paparazzi gigs all the time.
Oh, that's
So like they'll call again. You know what? Jerome David, Lance Bass is in town.
Yeah.
And if you
Go
can
to
just
the
go by the
airport.
right. And I'm like, man, God, could you imagine being the one who kills Lance Bass accidentally as the doc? Like
That's right.
I mean, it's Lance Bass, people. If he came in my emergency room, I would throw my panties at him.
Oh, good to know.
Just so you know.
Okay, I'll stay out of your emergency
This is
room.
Lance Bass we're talking. I was trying to think of a celebrity that'd be funny, and I'm like, Lance Bass, of course. Yeah. So the VIP effect, I think it's important for VIPs to know that you want to be treated like everybody else.
And, worse than VIPs, doctors.
Okay, this I want to talk about because I talked to some insurance guys, and they were saying doctors are the most expensive. So in other words, if you're trying to insure a group of doctors as a group, it's like
Health insurance?
Health insurance. It's poison because they order tons of tests. They end up having all the complications, and they always want to see the most expensive dude and get a butt ton of like esoteric stuff. Do you think that's true?
It probably is because, sometimes we can order our own tests or order our own stuff or push the doctor. Oh, I don't want this, I don't want just a regular X-ray. I want an MRI. You don't really need an MRI. But how about getting an MRA, or get this other, 10th level test that I just feel like I should get because I heard it's cool.
Right.
So yes, I agree with that. But I think also, when you're treating doctors that are not in your specialty.
Oh, it's stressful.
Yeah.
It's a VIP effect.
It is. And it's also that they, I always call them like doctors adjacent. They're just kind of like skirting that line of knowledge, but they don't cross it. And it's dangerous.
It's a Dunning-Kruger.
And it makes me crazy.
It's a Dunning-Kruger. So like if I come having no ENT knowledge.
Yeah, well, and I'm clearly you don't.
How dare you, Nina Shapiro?
Kids have sleep apnea?
Here I am, hyping your hype book. You know what?
No, they don't. Yeah.
I sensed a certain dismissive arrogance in you from the minute you stepped in my studio. And you know what?
Never.
I appreciate it and I love it because I have the same dismissive arrogance. It's true. And I think the idea that you don't know what you don't know. And so, again, it's a little Dunning-Kruger with docs. Yeah. And so you'll get like, a psychiatrist asking for like this esoteric chemotherapy and you're like, no.
Yeah, that was in 1957. Yeah, we don't use that
you're
anymore.
Like, I want to amp a beryllium stat. You're like, we have not used beryllium
right, exactly.
since that scene in E.T. where they code E.T. in those tents.
I remember that.
Yeah, they were like, get me beryllium. I'm like, what is this? 1982? Right. Oh, it is.
It was, yeah.
It was. And also, why would they give an alien human medicine?
Oh, because he was like a human.
Well, but
a
human that you could see his heart through his chest.
Yeah, that was cool.
He turns white like a chameleon.
Yeah, he had pentology of Cantrell.
Wow.
There you go. There's a disorder.
Dang.
Yeah, they literally have like their heart open. Isn't that cool?
I've learned something today.
Yeah.
Wow.
Look it up. Look it up.
Pentology of Cantrell. I like that. It sounds like an album cover for Metallica. Let me see here. Okay. So we talked about dog. We talked about a bunch of stuff. I'm going to take a couple comments, and then I think, be ready. Be ready. Jerome, who throws feces, says Narada Tisdale. That's our scrub tech, our surgical tech. Fava beans, Annie Allen. They appreciate your deep reference to the Silence of the Lambs. They apparently have a xenomorph face hugger CPAP mask. That's interesting. Matthew Roberts tells us.
A kid?
That. Yeah.
Oh.
I snore and have insomnia a lot. I had a sleep test and the doctor says, you fight sleep, no apnea. Danny Coach.
Wow.
Danny,
don't fight it.
Yeah, you need some psychotherapy. Like me.
Yeah, CPAP won't cure you.
No. You need a little, I don't know what you need.
Don't fight.
Yeah. Weed oil stops all dreaming, says Joe Camp. Not a word of lie. I don't know about that. CBD
Can't
oil?
argue with that. I don't know.
I don't know about that. I find actually cannabis really disrupts sleep wake. So, it causes disruption just like alcohol to sleep wake cycles. That wouldn't be your field. Never mind. I was going to ask if you're seeing a lot of cannabis hyperemesis syndrome since the legalization of weed in California.
So there are a lot of kids who use cannabis oil. I mean, parents use
cannabis oil for seizures.
Seizures, yeah. That's been for years.
Right.
Well before this whole legal stuff.
Thing, yeah. I did a show about that and the data around that. It's really only a couple of specific
studies,
right, and unusual variant seizures, not your standard like rocking out.
Anecdotal.
When
it helps, it helps.
Right.
That's good.
Right. Nina Shapiro and Dr. Z, you rock, says Janine Post.
Love, yeah.
And let's see, what else? Tattoos. Okay, as a dental phobe, pick another example. So, you know what I bet, Nina?
A lot of dental phobes.
When you wrote that article, you probably triggered a lot of people who have fear of dentists.
Yes, and they're like, I'll never go again because I was traumatized as a kid. I hear that all the time. Well,
here's a question. Maybe they're onto something.
Yeah, they
judging by Amy
were.
Baxter.
Yeah.
But you're onto something too, which is we need to toughen up our kids. Now the question is that this is interesting. Now I want to research this a little.
Yeah.
This is fascinating.
So one thing that was looked at, and it was at our institution and a few other institutions, is how can you relieve anxiety in kids without drugs?
Tell me.
Right? So
because that's Amy Baxter's thing too. She has a device called Buzzy. It's a mechanical.
Buzzy is great for vaccines.
Oh, yeah.
I saw that, and that works. But what can you do if it's not a shot, but it's just anxiety, like of a medical procedure? So
vitamin A, Ativan, high dose.
There you go. That's not a drug.
Oh, sorry.
Right? That it's like a drug, right? So what would it be? So what kids need to do is they need to feel in control. Right. So how do they feel in control these days? Right. So they play
VR.
So either VR or watch or playing a game on their device better than watching a video. Because a lot of parents will come in and say, "Oh, watch, this video," and it's like this moronic thing. But if they play a game actively, even a little kid, where they feel in control, it's better than Ativan. It's better than Valium. It's better than a parent.
Wow.
Scary, but true.
So
and we looked at that. Like, is it like which relieves more anxiety? And it's actually playing a game is more anxiety relieving for a medical thing. So for dental stuff, maybe they should be playing a game as opposed to getting anesthesia. Right?
This makes perfect sense. And play the game while you're doing your teeth.
Yeah.
You're like Minecraft, chilling.
Go for it.
Dude, my kids,
Fortnite, kill somebody.
my kids watch videos on YouTube of other kids playing
Oh yeah,
Minecraft.
that's very popular. That's very popular.
I had no idea that
or
was
like
a thing.
building toy. You know, when they're younger, they
Right.
watch someone playing with a toy.
Right. Well, we're social creatures. We have mirror neurons. We want to kind of copy people. So, okay. Then I think here's a call to action, Z-Pack. If your kid or someone you know or your patients are about to get a painful procedure in their kids, give them a device with a game they like, and let's see what happens.
Yeah, play it. And that's not, but they have to also know that that's something to do at that time. I
Right,
don't want to
because
get in trouble
otherwise-
for like, oh, wait, screen time. So,
Nina Shapiro tells kids to have more screen time.
Screen time is for the doctor, the dentist, and the airport. Right?
Then you go on the doctors and you have to
Right.
explain. Actually, trying to explain nuance on a TV show it gets
tricky.
a little
Yeah, it's
challenging.
fine line.
Yeah. Anything else you want to say to the tribe of healthcare people?
Oh my goodness. I think that, we just have to keep at it because as much as, we hear today, there's this crazy measles outbreak going on in the Pacific Northwest. There's going to be something else. And we always sort of have to keep on our toes too. And that was one of the challenges of writing this book is that, okay, so this was really, really important when I wrote it. And I even acknowledge that in the book, like when this book comes out, there's going to be something else that's not in here. And I think that as healthcare providers and healthcare providers, we're also patients and we also have families that we need to sort of open our eyes and not just accept what we hear. Careful when we read the news, careful of our sources, and just get ready for something else because there's going to be something. We're going to have to drink 7 glasses of water a day. There's going to be a new number because 7 is a lucky number.
7 is really lucky, just like the 10,000
Yeah.
steps. Guys, I want to thank Dr. Nina Shapiro.
Thank
She
you.
wrote the book Hype, and I've read this book cover to cover. It is a great guide for both doctors and patients and healthcare professionals of all stripes to cut through the garbage and give us tools where we can understand how to weed out nonsense, which is a basis of our show, is always trying to debunk garbage. Thank you for writing this great book.
Thank you.
Thank you for being such a great clinician. Thank you for yelling and teaching at me. And we out. Peace.
Yay! So much fun.